We are in the treatment room in Serenity, and we're discussing with the client, Diane, about her Botox and filler concerns. Diane, can you show me what areas that you have that are bothering you today?
I would like the forehead lines less visible, the big line between my nose, and then of course these lines bother me, and the little ones around your eyes also.
Okay, great. Diane has a major event coming up, and she mentioned that she had several areas that she was concerned about that she'd like to have a Botox treatment. Raise your eyebrows, Diane. See the lines that are formed when she raises her eyebrows? Now make your little frown. And when you frown or you concentrate or the sun's in your eyes and you're squinting, you get the little 11 lines here. That's caused by muscle movement. Botox will treat that. Smile real big. And when you smile, it lights up your face, and it's beautiful. But as we get older, we do get a little bit of line formation here from the muscle movement around the eyes. And Botox treats that very effectively. Okay, we've applied topical anesthetic to this area around the crow's feet, and it's a combination of lidocaine and benzocaine and tetracaine, so we need to know if you're allergic to anything that ends in with a cane. Most of these things are used at the dentist, so most people have had experience with Novocaine or Carbocaine or lidocaine before. This has been on for a few minutes. It doesn't take long for it to take effect. And then we do our alcohol swipe just to cleanse the skin and get the makeup off so we don't introduce any microbacteria or microorganisms into the skin. Our syringe, as well as our needle, is very tiny. And can you smile for me, please, Diane? We just make a couple of very small injections right into the skin. I place my finger on the orbital bone, and that's just to make sure that everything stays where it should. Now the dosing for the eye area is anywhere from 10 to 20 units on each eye. And a unit is a very small amount, but it's very potent. So Botox is precious. And we just hold pressure for a few minutes, and that helps to avoid or prevent any bruising. Now we're going to treat the right side of her face exactly the same way. She's had topical anesthetic on this side of her eye as well for several minutes. We just cleanse with an alcohol swipe. Does remove the makeup, ladies, so it's nice to have some in your purse when you come for your treatment. And on this side, I'm going away from the eye, but I'm still holding on the orbital bone just to be on the safe side, avoiding any vessels that I can see. Face is very vascular, so it's not unusual to experience a small amount of bleeding. However, bleeding doesn't necessarily mean that you're going to experience bruising. And if we apply pressure for several minutes, that helps to prevent any bruising. We've just finished the crow's feet treatment with Botox on Diane here. And one thing I just wanted to point out to be perfectly clear, can you smile again for me, please? These lines here, this is very close, right in the cheek muscle. So we can't go that low with Botox because we could potentially drop the cheek, and nobody would want that. And that would affect the smile, and it wouldn't help things at all. So we have to stay up here in this area. So just to set expectation, a lot of us do have this formation. Some people have long lines that go down the face, and there's other things that can be done, but we can't put the Botox up in this area of the cheek or in the muscles of the cheek here, just for clarity's sake. Now I just wanted to ask you, Diane, was that uncomfortable?
No, it really wasn't.
The most things that I hear patients report is like a popping sound when the little needle enters the skin, and it's like a little crunching or a popping. That can be a little bit unnerving, but nobody really reports that they experience pain. I'm gentle, and it's over really before you know anything has happened. Would that be a fair statement?
That's, yeah, it's not.
Well, I also want to point out that, as you can see here, I was pointing to her lines, the effect of Botox is not immediate. It takes anywhere from 2 to 10 days for Botox to take effect. On some people, sometimes a full 2 weeks. That's rare. Some people do experience almost immediate results, but that's very rare. So you have to be a little bit patient with your Botox. You'll wake up one morning and look in the mirror and say, oh my goodness, those lines are gone. And that is a very happy day.